Back, folks. The time of the clock is now 6:13, and thanks so much for being with us. And joining us now live this morning is Miss Kelly McAllister. She's a nurse practitioner from Flowers Medical Group, and we're so happy to have you. Thanks so much for being here with us.
Good morning, Tanya. Thank you.
Yeah, absolutely. So what are some of the things that someone should do to stay on top of their health issues?
I think one of the most important things is to have a primary health care provider to start with. Having a relationship with your doctor, nurse practitioner, physician's assistant ahead of time to be able to talk about those issues. You want to have someone that you are comfortable with to talk about not only issues that you're having, but issues you may have in the future. Secondly is to practice preventative health care, and that includes vaccines and screenings. And the last thing to do is to be honest with your health care provider. Knowing the issues that you're having, whether that be at home, at work, I'm not sleeping well, I'm not feeling up to par. If you're not honest about those kind of things with your healthcare provider, then we can't help.
Right. And like for me, for instance, I don't have a regular per se doctor other than a dentist or maybe OBGYN. What age should you really start going and getting those routine yearly screenings that you were talking about?
Well, those screenings are really important from the time you leave your pediatrician. Right, yeah. And we don't think as adults that we need to see healthcare providers yearly, but it is very important. And you may not have a big thing to schedule every year, like a colonoscopy or a mammogram, but it's still important to talk about those things that you can do to prevent, whether that's your vaccinations that you need to have, whether that is just talking about depression or smoking cessation. There are lots of things to talk about to keep you healthy further on down the road.
Okay. And so obviously, why is it so important to take these preventive health measures?
Preventative health care is by far the best thing you can do for yourself. Healthcare costs in the United States have skyrocketed over the last years, not only with hospital bills and medications and surgeries, but those things are very important to try to prevent. The number one thing we can do is screenings. We can help with mammograms and colonoscopies to try to find those diseases early and to be able to prevent them. Another thing you can do is get vaccinations. Not only your flu vaccine and your pneumonia vaccine, but there are vaccines actually to prevent cancer. Cervical cancer is preventable with a simple vaccines. There are many strains that are affected with this, and that's something that you can talk with your healthcare provider about to see if that's an effective solution for you. Of course, flu shots every year are important, and the shingles vaccine. We have a new shingles vaccine that is effective for many adults, and if you've ever known someone who has had shingles, it's a very painful disease, and very effective vaccinations for that. And one of the most important things, as well as lifestyle modifications, is if you can eat a healthy diet, if you can exercise, if you can do those screenings, smoking cessation. You know, your healthcare provider is going to say, you know, low fat, low sodium diet, but if you can make a decision at McDonald's to have a grilled chicken sandwich instead of a fried chicken sandwich.
Just taking those baby steps to make different changes.
Those small steps are so important.
Common sense stuff to kind of be healthier. Okay, so how often should somebody see their medical provider? That's annual basis?
Absolutely. And like I said, there may not be big things to do every year, but you're going to be able to talk about the things. You're going to be able to talk about your history. You know, do you have a high history of cardiac disease in your family? Do we need to do extra close screenings to check for that? Or do you have diabetes in your family? Your mom and your dad both have diabetes. Well, we need to make sure that every year we are checking your sugar so that we can find that early. Diabetes has a lot of effects other than just sugar. You know, it affects kidneys, it affects the blood vessels and the nerves.
My mom was a diabetic.
And if we can control that early, then we can lessen the effects later on down the road.
And correct me if I'm wrong, but genetics does come into play, but by eating right and exercising and taking some of those proactive steps, it's not all genetics. I mean, you can actually ward off of that. That doesn't mean that just because your ancestors or your mother or grandparents perhaps had something that you're going to get it as well.
Sure. Diabetes is affected by several things. Heredity is definitely a factor, but insulin resistance causes the body not to be able to use the insulin it produces already, and that makes the sugar go up. And that's caused by a lot of lifestyle, lack of exercise, obesity. And so if you can help control those, then the diabetes can be lessened.
Okay, and so let's talk about that, the screenings and whatnot that you were talking about earlier. Like for colonoscopy, is that general age when you should start that is around the age 50? And mammograms, is that usually typically around, what age is that? Do you start those?
Colonoscopies, yes, 50 is our age. And there some organizations that say that needs to even be 45. Most insurances haven't gotten on board with that quite yet. So age 50, and then every 10 years, unless you've had something that they've found on colonoscopy. Mammograms, it honestly, it depends on your insurance. Most insurances will pay yearly, but some have seen that, you know, they think every 2 years is appropriate.
So maybe start at 40, 45 to start getting these?
Yes, absolutely. Age 40 for your first mammogram, and then every year once you turn 45.
Okay. Now, are you accepting new patients? I have to ask you that. Let's tell everybody where you're located specifically.
Okay. I'm currently located in Internal Medicine Associates. We are over by Flowers Hospital.
Right.
And yes, we are accepting new patients. We have both physicians and nurse practitioners on staff, and be happy to begin a relationship to keep our patients healthy.
Now, this may be a silly question, but does somebody need a referral to come see you, or?
No, they do not.
Okay.
They can call our office phone number at 793-5074, and we'll be happy to make an appointment. You can also request an appointment online. You can go to flowersmedicalgroup.com, go to the location for Internal Medicine Associates and request an appointment.
All right. Anything else you want to add that I didn't ask you this morning?
No, I think that just the number one thing is to definitely have a relationship with a healthcare provider, because my thoughts is you don't change the oil in your car, your engine is going to die.
Yes,
so if you don't keep that preventative health care with your body, it is going to break down.
We need to take care of ourselves.
Absolutely.
All right. Thank you so much. It was a pleasure to meet you.
Thank you
for being here. And we'll be right back. But first, we're going to go ahead, I believe.